I'm Dr. Sheila Schuster. I'm a licensed psychologist, and I'm the executive director of the Advocacy Action Network. The Advocacy Action Network is an umbrella organization that has several coalitions as part of it. One is the Kentucky Mental Health Coalition, which is celebrating its 30th birthday this April, and is really concentrates on mental health and general health issues. We also have the United 874K Coalition, which is a coalition of individuals with disabilities, their family members, advocates and providers, representing the over 874,000 Kentuckians who have a disability that interferes with the task of daily living. We also have Kentuckians for Healthcare Reform, which was really the original consumer voice on healthcare issues, and has kind of morphed into Kentucky Voices for Health, and I'm chair of the board of Kentucky Voices for Health. We have a Medicaid consortium that kind of rises up and does work when there are specific Medicaid issues. So that's the Advocacy Action Network. The managed care companies that got the contracts, two of them have their own subsidiaries that deal with behavioral health, one does not. We reached out immediately on behalf of Kentucky Mental Health Coalition, and I had been meeting with interested parties from the very beginning. I had three messages. Number one, please, please, please do not mess with the medications that our people are on. Secondly, we asked them to be aware that if hospitalization was necessary, then people should have access to that service, and they should have access to it for as long as it takes, again, for them to be stabilized. The third was a real plea to the managed care companies. We have very strong consumer and family member voices here in Kentucky, and I asked them to please incorporate those voices, to really reach out to the NAMI, National Alliance on Mental Illness chapters all over the state, to access the consumers that we've really done a lot of advocacy training with, to make sure that they understand their rights to speak up and really let people know what their needs are. We had an excellent meeting in the beginning of August. All three of the managed care companies were there. They promised us all kinds of things, and quite frankly, it's not happened. We have numerous stories, and there are more each day, about people whose medications have either needed to be prior authorized by the prescriber with a very difficult process, or where people have gone to the pharmacy and their medications have not been available. And I think what people need to understand is that with some of our consumers, if they go to the pharmacy and their medications are not available, they make some assumptions because of their illness that they're not supposed to take that medication, or that it's not good for them. And they walk out of that pharmacy and they don't come back the next day to see if it's been solved. And we're seeing those cases time after time after time. We're feeling like we're getting squeezed, so the medications aren't available, but they're also ratcheting down on the number of days in the hospital and the process for getting into the hospital. So we really feel like our behavioral health consumers and family members are really on a slippery slope here that's not going well. I think it's really scary to think about this not getting fixed, and I keep thinking that surely people that care, and I think actually every one of these groups that I've talked about care, but it's so disorganized, so disjointed. Again, the analogy that comes to mind is, you've got this balloon and you press on one thing to try to get it fixed, and what it does is to bubble up over here, and then we're reaching over here to try to get it fixed.